and welcome, and thank you very much for joining us for the first ever Newcastle Discover event, which is Mind the Gap, today's data for tomorrow's innovation. Newcastle Discover is a brand new programme which is hosting knowledge exchange and personal development events each month. I'm Lucy Pritchard, I'm the Alumni Relations Manager. So we would love to hear any discoveries that you've enjoyed hearing today at this event. So please do share them on your social media channels using the hashtag NCLDiscover. So thank you very much again for joining us. And without further ado, I will be introducing our event chair, Professor Steve Caughey. Steve is director of the National Innovation Centre for Data, which brings together industry, the public sector, and world-leading academics to develop the skills, ideas, and resources needed to exploit the opportunities offered by the explosion in digital data. Steve worked as a software engineer and systems architect before joining the influential Arunja research team at Newcastle University in 1990. He was instrumental in commercializing the prototype work of this group by co-founding Arunja Solutions in 1998. Steve led this startup company to acquisition by Hewlett-Packard in 2000, bought back the company, renamed as Arunja Technologies in 2002, and sold part of the product suite to Red Hat in 2005. As CEO, he was responsible for strategy, corporate development, and partnerships. And having had many conversations with Steve, he has the ability to make the technical very easy to understand. So I'm very glad he has joined us today to chair this event. Thank you very much, Steve, and I'll pass him over to you.
Thank you very much, Lucy, for that very kind introduction. And welcome, everybody. Good afternoon to all of you. So as Lucy said, my name's Steve Caughey, and my role right now, for at least for one more month, I'm retiring in 1 month's time, actually. My role right now is as Director of the National Innovation Centre for Data. So I just wanted to start out just by giving you perhaps 2 minutes on the sort of the Newcastle data grouping at Newcastle University. So Newcastle University has a lot of areas obviously it works in, but it's beginning to focus on certain areas where we have particular strengths. And one of those areas is in data. And data, as you know, is everywhere. We're generating more and more of it through social media and sensors and all sorts, and it's increasingly impacting upon our lives. And that's true of the research field, where it's almost impossible to do research in any area these days without having some understanding of data and analyzing data. And it's certainly true in the commercial field and in the public sector as well, where people like the NHS and local authorities need to analyze vast amounts of data. And what we've done at Newcastle University rather uniquely is we've tied together the people who are working in data into sort of a single unit, a virtual unit, but a single unit. We've tied together the people who are working in research, the people who are working in teaching, and the group who are focusing on engagement. And that's largely what the National Innovation Centre for Data does. So those three groups work together closely, sharing resources, integrating the various functions that they're doing within the university. And our argument is that great research, and all of this is founded on the great research which is done by Newcastle University, leads to great teaching, and that produces the people who go out into society and create the impact. And then if we're doing this right, we can re-engage with those people to discover what they and their organizations need next from research and from teaching to inform us as to where we should be moving in both of those areas and drive an innovation cycle around. And we've been working on doing that very effectively for the last few years. In fact, we're in the computing science area in particular, we're ranked #1 in the UK for the impact of our research upon society, upon public and private sector, and beating Cambridge into second place, which I always think is a more impressive statistic than the fact that we're first. Okay, so that gives you a sense of the sort of joint work that we're doing at Newcastle University. But now we're going to highlight just a couple of examples, 2 examples of some of the fantastic research which is going on at Newcastle University right now. So let me move on to my introductory slide. So first, let me introduce you to Professor Lynn Rochester. So Lynn is Professor of Human Movement Science, which is a fantastic title, I think. Lynn is an honorary consultant physiotherapist at Newcastle upon Tyne Health Trust. She has a PhD in transitional neuroscience. She was the recipient of the National Institute for Health Research Senior Investigators Award a few years ago. She leads the health research, clinical research network specialty cluster with an oversight of a research portfolio covering aging, dementia, neurodegeneration, neurological disorders, and so on. And she also is coordinator for the Mobilise D consortium in the UK. So that's the first of our speakers. The second will be Professor Rachel Franklin. So Rachel is a professor of geographical analysis in the Centre for Urban and Regional Development and the School of Geography, Politics and Sociology at Newcastle. She's the theme lead on spatial analytics within this grouping called Newcastle Data. She's a co-lead on the Centre for Doctoral Training. And her primary research is into spatial demography. She's also someone who we've been slowly convincing to indulge in British beer after having drunk American rubbish for many years. We've worked hard at getting her to join us in an enjoyment of British ale. Okay, so that's our brief introductions. Let me now move on to the presentations themselves. I assume Lynn's first, is that right?
I am. So thanks very much, Steve, for the introduction. I'm just going to share my screen. And I just want to check that you can see my slides and not the presenter view. Okay, that's perfect. Thank you. Well, I'm delighted to be here today to talk to you. So I'm Lynn Rochester. Obviously, I'm delighted to be here today to talk to you about our work, leveraging health insights from mobility data and how we're going one step beyond the lab and the clinic to the real world. So why am I talking to you about mobility? Well, from a public perspective, it's pretty obvious that mobility is important. And that's because mobility loss is common. It's increasing with our aging population, and it profoundly affects quality of life. And it's also what people care about, as you can see in these comments. And it's fair to say, I think we really don't appreciate our mobility until we lose it. And because of all of those things, that makes mobility an important feature to preserve and protect. And it is indeed an important global priority. What you may be less aware of is that mobility also gives us very important information. Research shows that changes in gait or the way we walk, such as a slower walking speed, might reflect changes in the brain and body and indicate, for example, if further tests are needed. These changes may be related to memory difficulties, Parkinson's disease, or possibly tell us that you're likely to experience a fall in the future. So we can therefore think of mobility as the sixth vital sign of health. And if we take those together, mobility can be thought of as two sides of the same coin. On the one side, to protect, and on the other side, to observe. And in order to address both, we need the best tools to capture mobility so that we can identify the right patient at the right time and give them the right treatment. And by doing that, we hope to transform clinical research and clinical care. And that's the focus of the Brain and Movement Research Group that I lead, which is a multidisciplinary team of clinicians, engineers, biomechanists, psychologists, data scientists. And our research is aimed to help people live as independently and as well as they can for as long as possible. This slide gives a summary of some of our work, and just to summarize that for you, our work has helped identify discrete measures of gait, can help support the diagnosis of Parkinson's and dementia, can predict falls in the future and cognitive decline, and it's also been useful to help identify the underlying cause of gait impairments in Parkinson's disease, which is helping us target the development of new treatments. The work, however, has largely been carried out in the laboratory in the Clinical Aging Research Unit. So we really need to think about how we translate these findings for use, for widespread use. And to do that, we've used digital technology to continuously measure real-world mobility and developed algorithms to measure and model gait and wider mobility outcomes so that we can use them to understand health conditions and develop new treatments. This video provides a view of the overall concept that we're using. we know from our work that measuring mobility in the real world gives us novel insights into health management that really have previously been unobtainable, and this is due to technology and data development. And this also helps reduce burden on patients and clinical teams and increases access to research and healthcare, and therefore provides us with more inclusive solutions. As an example of the translational findings that we have had to date and summary of our wearable studies and insights, using wearable technology and data analytics, we've shown that it's possible to identify Parkinson's disease early and even predict who may develop dementia in the future. And in dementia, we've shown that gait is different depending on the type of dementia, and this work has informed clinical guidelines. Insights for activity are now leading to novel approaches to maintain independence and inform care in Parkinson's, dementia, and delirium, amongst other conditions. Real-world mobility, therefore, does provide us with important insights, but there are many challenges remaining before this becomes business as usual, and this is what we really want to achieve. So we're now working on the next step towards adoption. And we're doing this through the Mobilise Consortium, which is helping us to take this final translational step into the real world. The Mobilise Consortium is aiming to bring real-world digital mobility assessment into widespread adoptions, but this is across multiple health conditions. I lead the consortium together with Dr. Ronan Rubinov from Novartis, and Mobilise, as you can see on the slide, is a partnership of 34 partners working together from academia and industry, who are also working in partnership with patients and regulatory authorities such as the European Medicines Authority and the FDA. And we're doing that to ensure that our work is fit for purpose and will be used in the future. We're funded through the EU IMI initiative for a 5-year period, and we commenced our work on an auspicious date, April the 1st. We did this in 2019, just in time for the global pandemic to roll out. So it's been interesting times. Mobilised in a nutshell is as follows. There are 3 major challenges that we need to address to meet our objectives. Firstly, we need to demonstrate that we can use a single device, as shown in the video, with the level of precision necessary to measure a range of different outcomes to support their use in the evaluation of new treatments and drugs that the pharmaceutical industry are interested in, and also in clinical care. Next, we need to show that these digital measures of mobility have clinical validity, and we do this by exploring these range of different diseases, and we want to see that these outcomes are able to measure change over time, discriminate between different diseases, and also predict adverse events in the future, such as falls, hospitalization, and other adverse events. And then finally, the major challenge, and this is a huge challenge, is we have to take all of this evidence to the regulators to convince them that these are the best digital tools and methods to be used in clinical trials of the future. And that is a piece of, certainly a challenging piece of work that we are doing. And ultimately, we hope that this would lead through into improvements in healthcare. So this slide is just an example of how we're addressing the first challenge using data science to validate real-world mobility assessment in Mobilised. And first of all, we've carried out a world-first technical validation study in 120 patients from the cohorts that you saw on the previous slide to demonstrate it's possible to adopt this single sensor approach. And this has been carried out in 5 clinical sites across Europe, with Newcastle, the Clinical Aging Research Unit being one of the lead sites. New data visualization methods, as shown here, and I'll just run this video. These developed in Newcastle allow us to explore data from the individual person through to the population and in a range of different testing conditions. By combining these insights with advanced analytics and developing digital data analysis pipelines, we've been able to transform the analysis of millions of data points and identify the best mobility algorithms, delivering results. This has really helped us to deliver results in vastly reduced timescales from that which has been previously possible. Working in collaboration with Professor Paul Watson and the team, we've used eScience Central, which is a cloud-based analytics platform to support our data management, storage, analysis, and visualization, which is another first in kind to handle such complexity of real-world digital mobility data, plus its integration with multiple data sources. And this is really now underpinning our clinical study. So the work is truly powered by data science, and our approach has been endorsed by the European Medicines Authority overall, and that gives us confidence that we're doing the right things. And then finally, our knowledge is now being applied to develop and test digital interventions. We're using artificial intelligence to develop data-driven models for diagnosis and prediction of dementia and Parkinson's disease, carrying out developing personalized real-world and real-time digital tools to manage health and medication. We're discovering and validating novel digital outcomes to enhance care pathways in dementia and other conditions. And we're using digital health devices that can be deployed in the home to improve gait in Parkinson's disease. So if we come back to the two sides of the same coin, by continuing to address the two sides of mobility to protect and observe, our work powered by data science, clinical insights, and engineering and patient insights is aiming to develop the digital healthcare tools for the future to transform health through digital mobility assessment, moving us one step beyond to the real world and hopefully business as usual. Finally, I want to acknowledge my team. Many of the people I've listed on the slides, these are the people who are really leading a lot of the research. Paul Watson and his team, the Digital Institute, the whole of the Mobilised Consortium. There are 300 partners in the consortium working together to address our challenges. All of our funders who have funded the research that I've shown. And finally, last but not least, patients and the public. Thank you.
Fantastic, Lynn. Thank you. Thank you very much for that. I'm now going to hand over to Rachel, but whilst we're doing so, just wanted to point out we're going to answer questions in the Q&A session at the end, but just also wanted to point out that Lynn displayed the new Catalyst building on the Helix site as part of her presentation. This is a beautiful building in the centre of Newcastle, focused on both aging and on data. And if anybody would like to come and visit us at any stage, there's a beautiful cafe there. I'm happy to give tours. It may be something I do in my retirement, is become a tour guide. I've done so many of them. So if anybody wants to come and look around, please do contact me and I'd be more than happy to show you around. Okay, let me hand over now to Rachel. Are you there, Rachel?
Yes. Great. All right, well, thank you for having me. I'm really happy to be here. And probably all of you have heard the term smart cities. The phrase is ubiquitous and is used here to capture many different ways that cities use technologies to improve efficiency and quality of life for inhabitants. Think about timing stoplights so that traffic flows more fluidly and unnecessary air pollution is prevented, or dashboards that can be used to visualize coronavirus illness or vaccination rates across neighborhoods and over time, or sensors that identify where a water leak has occurred. My research focuses on one small aspect of smart city infrastructure, sensor networks, especially those that are used to monitor air quality. I'm especially interested in where sensors are placed within the city to ensure that data are captured for all groups fairly and equally. Look around and up when you're out for a walk, not only in city centers, but also in residential settings. Most larger cities employ a variety of sensors that capture temperature and precipitation, for example, but also often movement, traffic, and yes, air quality. And when we talk about the ubiquity of sensors in the smart city, one thing that usually comes up is the issue of surveillance. If you look up, you'll often notice a CCTV camera. All these sensors that capture individual movements and behaviors. One thing we talk less about is the importance of especially environmental sensors for providing evidence of uneven or unequal exposure to environmental ills such as pollution. In those cases, it's important that sensors be placed in locations where the vulnerable are located, and that's where we step in. As individuals, we're both affecting and affected by our local environment everywhere we move within the city. Air quality sensors capture the locations where pollution is produced, for example, busy intersections or bridges that often have a lot of stopped traffic, but should also provide measurements of where people are located. Vulnerability is created not only by the creation of hazards, but also by the exposure of individuals who are affected by those hazards. Increasingly, cities, research councils, and industry fund the placement of sensors across cities globally. This example here is from Newcastle's own urban observatory, and the map shows locations of a variety of sensors, including noise, weather, traffic, and air quality. My example today is from Newcastle, but the findings would hold for virtually all cities. Sensor networks are everywhere. This example here is from the Array of Things project in Chicago, and the graphic shows how data from a variety of sensors can be integrated, analyzed, and served up on data portals and dashboards in near real time. Much of the focus in network development is on these issues: data streaming, serving up data, etc. But what about the big initial question about where to put the sensors in the first place? And it turns out decisions around where to place sensors are difficult. This is primarily because people and pollution are not uniformly distributed across the city. Different types of people live in different parts of the city. But it's also because good air quality sensors are expensive. So it's not a question of simply placing thousands of sensors across the entire city. Moreover, what do we mean when we say that sensors should represent all groups across the city? Do we mean accurate data for everyone? Or are we talking about broader issues around political and social representation? Our answers will matter here. And finally, with a limited budget for sensor equipment, there's going to be tension between covering people and covering the pollution source. And this is where we step in, with an aim to develop tools that can help decision makers and stakeholders visualize the process of deciding how many sensors and where to locate them. One way of understanding spatial inequality in England is the index of multiple deprivation. This provides a multidimensional measure of well-being across small local areas. Newcastle, shown here, has neighborhoods of great prosperity and well-being, but is also home to some of the most deprived in terms of health, poverty, education, and more neighborhoods in England. It would be reasonable to expect that many of those most vulnerable to poor air quality might live in these areas. However, given a limited number of sensors, we might end up with holes in coverage elsewhere in the city if we focus only on these areas. This map provides an indication of how many people can be covered by placing just one sensor. The initial demographics that we work with are the total population, children, the older population over 65, and the daytime location of workers. Darker colors on these maps indicate a higher share of that group that can be reached by placing one sensor in that location. From the maps, it's pretty clear that the locations that provide the biggest bang for the buck, so to speak, for some groups, will leave other groups almost entirely unrepresented. This is especially clear if you compare the very clustered nature of the workday population in the bottom right to the older population just next to it. Children in the upper right display yet another spatial pattern. So what to do? If we make some assumptions around coverage, as well as the number of sensors in the network, we can use optimization algorithms to suggest the best locations in the city for a given number of sensors. This sensor network on this set of maps here aims to cover the older population in Newcastle with either 10 or 55 sensors. The bottom right map shows a sensor network with 55 sensors, which covers just over half of the city's older population. If we limit the number of sensors or give them a smaller potential range, then we cover much smaller areas of the city and of the total population. This is what the other maps on this slide are illustrating. As you might have guessed from the map showing differences in the locations of each group in the city, a similar set of networks for the workplace population will result in a very different geography of sensors. The coverage level is much higher since workplace locations in Newcastle tend to be so clustered. This means that a similar network in the bottom right of the screen can cover almost 80% of the workplace population. So this is good, but what about children and older people then? We start to see that there are trade-offs. At the moment, we've been working on what's called a decision support tool, and this incorporates the algorithms and the networks that are generated into a user-friendly interface that allows hands-on exploration of the impacts of different sensor network scenarios. For each given scenario, the tool can show how coverage across different groups and locations varies. Users can select one or more priority groups that sensors should seek to cover, as well as an input number of sensors and what we call theta, which is a measure of each individual sensor's reach. Once the algorithm runs, users are presented with a map showing sensor locations, but also an interactive graph that allows them to explore the connection between coverage, here total residents, and sensor locations in the city. The highlighted triangle on my graph indicates that this is the network I'm looking at on the map. This network offers coverage of just over half the total population of Newcastle, and is about the best performing network. Other choices would reduce coverage to about 48%. It's the visualization of trade-offs that's especially exciting, to me anyway. This combination of graph and sensor network, if you look at the small triangles, shows that the proposed sensor network on the map does very well in covering the workplace population, but is near the bottom of the pile for all the other groups. Users then can opt for semi-bespoke networks with the desired amount of trade-offs across each group. We're still hard at work on improving this tool, including allowing users to input their own networks and then assess the resulting coverage at different groups. We're also working at incorporating locations of the sources of air pollution as well. I realize that this has been a whirlwind tour, but I'm very grateful for your time and look forward to your questions. And I should say that this is very much a team effort, that it takes data scientists to work with the data and the optimization algorithms. It takes human computer interface people to build the tool. It takes geographers to think about what coverage means. Yeah, and so this has been ongoing work, but very pleasurable to get to work across so many domains at once. And with that, I will stop.
Thank you very much, Rachel, for that whirlwind tour. So we'll now move into our Q&A session. So maybe we'll start out just with a couple of initial questions that are sort of specific to each presentation before we broaden it out and be a bit more general. So starting out with a question from Neil in the audience. Neil's asking, Lynn, is the gait analysis that you're doing equally viable for people who are already mobility impaired, people using walking frames, for example?
That's a really good question. And actually, it's something we're addressing in the Mobilise Consortium, because we are trying to develop tools that are suitable across all ranges of mobility, from people who walk without any difficulties, so we can study early changes in early conditions, all the way through to people who have some considerable mobility problems, and they would be people with Parkinson's, with multiple sclerosis. But we're also in Mobilise recruiting a population of people, older people who are recovering from hip fracture, who do use relators and walking sticks, and the population as well use them. So we are making sure that the algorithms are able to work effectively across all of those populations, and we're also looking at instrumenting some of the walking aids as well.
Very good, thank you. Yeah, and a question around how you're measuring gait. So your video showed some video analysis of gait, whereas it seems to me, and correct me if I'm wrong, that your emphasis now is on wearables and cheaper, obviously, devices to let you measure gait. And is that true? Is that where you're moving?
Yeah, so the video was really showing a sensor, and we're not using video analysis. You would use video analysis to validate the accuracy of data and the accuracy of algorithms. So that would be considered the gold standard. And we use 3D motion analysis as well in the lab when we want to do some very constrained testing in the clinical aging research unit. But we're focused on a single sensor that you saw in the video, which can be attached to the low back, or where, of course, I'm wearing a wrist-worn device, I should say, a single device, because they contain multi-sensing, they have a multi-sensing capability. So that's the approach. So it's as low burden and as simple and low cost as possible.
Great, thank you, Lynn.
And I should say that we've got really excellent results from we're just looking at our real world data from the technical validation study. We're now able to be defining the final algorithm pipeline, and the results are absolutely, they're really, really good. They're probably better than we could have anticipated. So it's a really exciting space to be in.
Very good. And one last specific question for you, Lynn. So how valuable is some of this early diagnosis that you're doing for the public good? And, you know, in the sense of early diagnosis of Parkinson's, or, you know, is presumably getting in early and providing early treatments actually is, it's beneficial for the individual, but also saving the health service, presumably in the long term as well.
Well, I think you've just answered the question there
for
me. That's all right. You're absolutely spot on. You know, if you've got a neurodegenerative condition, to be able to identify people as early as possible, that's the window of opportunity to protect and preserve the brain. So there's a huge effort going on to develop a suite of biomarkers. These are specialist measures that allow us to identify people at this point, and that's across a range of different conditions. And that's the sweet spot for when you would start to test out novel interventions that are looking to modify disease progression or even neuroprotective therapies. So early intervention is crucial. And the earlier we intervene, the more we can prevent mobility loss. And it's not only mobility loss, it's the secondary consequences of mobility loss associated with all of these conditions that lead to additional health burden. And that ultimately means that the benefits for the public are that they lead healthier lives for as long as possible, and not living for a longer time with multiple long-term health conditions.
These are increasingly important issues to me. Anyway,
me.
so now some specific questions for Rachel, perhaps. So Rachel, just from the audience, Matt's asking, is there a view on making pollution sensors cheaper and mass produced for more geographic spread?
Yeah, the quality of sensors in general is always increasing, and the number of phenomena that we can sense is always increasing. I mean, if you think about the CCTV and what we track, I mean, during the pandemic, certainly in Newcastle, one thing that we tracked a lot with the cameras wasn't individual people, it was footfall. It was how many people were walking down the street at a given time, or how many cars are on the road at a particular time. So this is a combination of sensor technologies, but also, you know, the data science component that allows us to do novel things with the data. Where air quality is concerned, I get this question a lot, and I have the sense that in 20 years, we might look back and think, well, using individual sensors, which are sort of point-based, to capture something that is field-based or landscape-based, it's a continuous surface, right? Pollution or air quality is not super technologically advanced, and that I like to think that in a few decades, we're going to have entirely different ways of estimating with high degrees of confidence what the air quality is in any particular location of a city. You know, think about remote sensing technologies, for example, in satellite imagery. The higher the resolution the imagery is, and the more bands, the more information that's collected with those sensors that are up in the sky, the more I think that we'll probably get to the point where we can estimate what the breathable air is like for very high resolution locations within the city. So I think that we're going to look back and think, sensors, what an interesting idea for measuring air quality. On the other hand, these challenges, these inequality challenges, those aren't going anywhere. I mean, every single technological advance that we have, I think, ever experienced in human history has at least initially started out benefiting very few people, very few places and locations, and very few individuals. And we can usually predict who the people are who are excluded from these advances, right? I mean, it's not difficult. So I think these questions will always be with us. I don't think that we will ever reach a point where the technology is so smart and so good that everyone benefits equally, right? And so this is the argument that's often made. I mean, it's not just the questions that we have, the research questions. It's the technology and the data science components, but it's also these other aspects that force us, that drive us continuously to ask questions about why our world works the way it works, and to push back where possible. So
the tooling that you've been presenting, Rachel, is sort of about trying to provide fair coverage, whatever that means exactly. But I guess most decision makers in the public sector will be looking at return on investment for public funds and spend, right? How optimistic are you that the sort of tooling you'll produce will be adopted and in the face of just pure economics?
Right. So our argument is that if you have a fixed budget for a given number of sensors of a particular quality, wouldn't you like to know the best place to locate them to give you the answers that you're looking for, right? And it may not be coverage of the entire population. Maybe it is coverage of one very particular demographic subgroup that has much higher exposure to some forms of air pollution. This way you could optimize your network sort of automatically. The way it's done now is ad hoc, right? And of course, humans are not very good at these multidimensional problems.
Yeah, we get plenty of sensors in Gosforth, I think, right?
Yes.
Okay. Bob's asking, are you correlating the where to put sensors analysis with space syntax methodologies that show how people transit from, say, home to work?
So we use space syntax methods actually to try and estimate what the hazard would look like. So actually the source of pollution, right? Because most sensors that collect air pollution, they're, again, of course, they're point-based. So you get this sort of circular argument. So what we need are estimates that, again, are for a surface that give us a sense of where air pollution is likely to be higher so that you can incorporate that into the decision-making process for where to place sensors. Yeah.
Okay. Okay, so let's move on to a couple of general questions now for all of us, I guess. And the burning issue I think that everybody has is around gathering data and the threat to security and privacy. Yeah. So just on your own experience, because you're working with data, you're gathering what could be very personal data. What's your feeling about the sort of legislative framework that we're operating within in the UK? Do you feel that there are threats to privacy potential? Well, obviously there are potential threats to privacy, but are we well protected within the UK in terms of the protection of our data? Let's start with Rachel.
Well, I think that Lynn probably has the more interesting insights to
that's why I wanted you to
here, because it's medical. What I would say, I mean, just to sort of, I suppose, get conversation going, is that privacy is a social construct, and that the assumptions that we have around what we are owed in terms of privacy, these were not ever handed to us on stone tablets. We decided at some point that this is what was owed to us. And so I would like to say that when we have conversations about privacy, we should understand that this reflects the particular time that we live in now. That said, of course, individuals, I think, have a certain right to privacy, but I think that we also understand that we need inputs that come from a diverse set of sources when it comes from data to make sure that everyone's equally represented and covered. When I talk about sensors, I try to be very careful to point out that the way in which all sensors have been painted, I think, in smart city discourse is as sort of a threat to privacy and independence and surveillance mechanism, when actually you risk cities not placing air quality sensors, for example, these sensors that are about environmental monitoring and not people monitoring, that really protect the most vulnerable. And so I like to be careful about how we talk about these things to make sure that we're all sort of on the same page about the benefits of everyone opting in.
I mean, that's interesting. So just coming to you, Lynn. So I know that in dealing with sort of NHS organizations, governance is always a big issue, and there are always people who really understand the threats there are to privacy through data. But it's often the case that there aren't people on the other side of the balance arguing for the benefits of more effectively sharing data within the NHS. So what's your experience around how well protected our data is and whether or not that we've got that balance right?
Well, firstly, thanks, Rachel. I really appreciate that balanced view, and I think you're absolutely right. It's a bit like another two sides of the coin, really, isn't it? That we have to look at these things in balance. I'm also going to say I'm no expert on NHS digital and integration of data. So we all recognize the challenges, and we all see the anxieties around people's data and protecting their data. I'm not really working in that space. I think there is a whole other set of arguments in the space that we work in. We're all collecting and streaming data as we go. It's happening all the time, whether we like it or not. There's so much data out there about us. It's how that data, it's the decision making that's used from the data. I think that is really important to recognize, and that's where consent becomes very, very important as well. In the sort of work we do, people are protected because they're consenting very clearly to what we are doing with their data, who's going to see it, how it's going to be used. Their data is anonymized anyway, so there's no individual personalized profiles out there. But we still have issues. There is still work to do to really understand what people are happy to collect and share and for why, and particularly how we deal with this in diverse populations, in underserved populations. So when we're looking at lower socioeconomic areas, areas of deprivation, different cultural, ethnic groups who may have different views on continuously collecting data and how that's used, and then what people will be prepared to allow their data to be shared for, and the whole ethics around that. That's nearly another research area. We're trying to do some work in that specific area so that we then know how to connect that data into the system. So there's multiple stages involved in the whole process, really.
Yeah, because when you talk about consent in a research field, where you've got to ask for explicit consent for an explicit purpose and so on. But what does consent mean in the sort of public domain when public cameras are up, measuring people's gait, for example, or identifying who they are? What does consent mean in that environment, Rachel?
Well, so this again is, I'm not at all an expert on this. I think that, I think these are good questions. I think when it comes to observing footfall, for example, the researchers in those areas would say that they're careful to point out they're not looking at individuals at all. They're looking at almost like moving boxes, right? And how many moving boxes have passed by a particular camera. And so there's this sort of extraction. You go as quickly as possible to the abstract. Does that mean that these technologies couldn't be used for evil? Of course not. Of course they could be, right? I mean, these sensors, I put the most positive view on optimizing sensor networks, but of course you could take noise or any kind of observation and optimize networks to surveil people as best as possible too, right? So I think it's a lot about the framing of what we do to make sure that we try to ensure that technologies are used for good, and also that we've got lots and lots of protections in place to ensure that things can't really go off the rails.
I think it's also about people really understanding who has their data, what data is being streamed, who has access to your data, what's that data being used for. So it's again, and we see it in the news all the time now, don't we, about this whole sort of consenting to allow your data to be used elsewhere. So there really is a public education piece of work that probably we all, I would say myself as well, we continually need to be looking at that whole space as it evolves, and things are evolving so rapidly, it's very difficult to really have a good understanding.
Absolutely. So a couple of questions here about data sharing, about the data that you're gathering, and Matt's asking, for example, is the data that you're gathering in both of your projects, is that available to help other research and commercial organizations? And so I guess it's primarily open data once you've anonymized it, right?
Do you want me to go?
In our case, we don't work with so much data, it's the algorithms, and those are or will soon be openly available. So I think, there are two things that go on with analysis, right? There are the algorithms or the methods that you're using to try and derive insights, but then there are the input data, and those can both have different sorts of protections associated with them. I think there is a strong move to help ensure that the code that is used for the analysis is made publicly available for others to work with, but also so that people can see your workings. What were the assumptions that you made along the way? And I'm sure Lynn is about to tell us, but in my field, certainly this is the direction that we're heading in, both for commercial purposes, but also just for better research purposes.
Absolutely. Any algorithms that we develop, they really, the move is now that things are open so that they can be continually validated, in fact, and actually that just improves. That will only lead to improvements. So that would be the consideration. So we're not really dealing, black box designs are much more challenging to work with in that space. And with respect to the data that we're generating in, our data that we have in multiple projects in my team, but also the data that we're generating in Mobilised. Mobilised is funded through the EU. It's public purse funding. Half of it's funded through industry. We've got a very large sum of funding, as you would have seen on that slide. But we have to, because it's public funding, that the data, there's an expectation that the data is made available. And this is actually what we want. We've created a really unique technical validation data set that people aren't going to replicate those studies. They're so hard to do. And that's a waste of time and effort. So we will be making that data available. There's a bit of a process to do so. It's really complex data, and it's not a type of data. There are multiple types of data within that. And similarly for our clinical validation study, I didn't say how many people are involved in that, but we've got 2,500 people in our clinical validation study that's running now. That data will eventually be made available as well. The timescales, of course, always extend out a bit, but they'll become what we would hope to be digital biobank, data biobank repositories, really, that technical developers as well as clinicians, et cetera, can use.
Okay, thanks. Peter Kelly's asking a question of Rachel, which I think you've already partially answered, Rachel, around sharing of, he's talking here about sharing of data with other cities to help do comparisons and learn from each other. I guess what you're talking about is sharing the algorithms primarily.
Yeah, well, so the algorithms, that's one piece of it. And then, the latter part of the presentation was this decision support tool, which is the user interface. At the moment, for development purposes, we focused on Newcastle and Gateshead, but ideally, both would be flexible enough to take any input city, right? I mean, that's sort of the best case scenario, but that means that the code have to work a certain way, right? That it's very easy to build something to work just for one place and just for one particular case. It's a little bit trickier to ensure that it can work for other cities in the UK or other cities around the world, which I think would be our eventual goal.
Yep. Yeah. And Matt's got a follow up on that. He's saying, would your algorithms and data feed into a national digital twin, if such a thing could ever be built, and combined with other data sets? I mean, I guess that's a dream, right? Yeah, I mean, or a nightmare.
Yeah, I mean, so I can say, this is a little bit of an aside, but one challenge that we faced is that smart cities are really about cities. And in urban research, everyone talks about the share of the global population that's going to live in a city and how cities are so important. But many of these tools do not work well for rural areas at all. Yeah. Right. And so if you want to talk about spatial inequality, it's really interesting how and in different countries, it's different types of people who tend to live in the country, right? But in many countries, it's the poorer populations that are in these rural areas, and they're not covered at all by these technologies. Our methods don't work well to represent and capture information for them. So I think that that's a big challenge in thinking about national digital twins, because you get these gaps as you go between cities where you're not really so sure how to estimate anything.
Are we increasingly going to fill those gaps though with sort of wearable technologies and sensors? So you talked about air pollution sensors. Is it feasible to have them built into a mobile phone, for example, and people to carry their own?
I think that especially for sort of like just indicator variables, we're definitely heading in that direction. But
turning on alarms whenever the pollution level reaches a certain
height. I mean, that's the way the thinking is, but what that does is leave areas uncovered. And so you have to assume that, if there's an empty field, then it's not important. I mean, this paradigm assumes that where there are no people, you're not really interested in collecting information, which is a very interesting worldview when thinking about the environment, right?
The sensor doesn't hear something happening in a forest.
It hasn't. Right? Exactly.
Okay, thanks, Rachel. And Lynn, a follow up for you as well. Someone who's anonymous, I'm not sure why, says your algorithms help understand a disease, but can we also determine a well-being baseline versus those diseases? So can we tell if a person is aging well through their gait and define a longevity trajectory?
That's a really good question, and yes, I would hope we would get to that stage. There's certainly there was a lot of early evidence from aging studies actually that indicated if your walking speed fell below a certain threshold, then that was really a bit of a red flag that there were other problems going on. And we probably need that much more population level data and different populations as well to really collect all of that. And ultimately, I suspect it will be something that we may monitor. One might think if the signals from these measures are shown to be really sensitive, then it might form part of a health screen, which, you know, a long time into the future, we would be screening these things. And the way we screen for have multiple health screening tools at the moment. So that would help us to build up that database. But certainly some of our work in people who are what we would call in the prodromal phase of a condition. So they're not expressing clinical signs. They haven't had a diagnosis. So things are happening in the brain, but there's no diagnosis from a doctor. We can detect early signs, and there's emerging evidence that this is feasible. So that fits into this aging well longevity profile. But there's a lot, obviously, there's a lot more work to be done. But
does that integrate with some of the research around analysis of speech, for example, you know, through Alexa and Google and things like that? You can do a certain amount of analysis as well, can't you?
It absolutely does, and people are interested in looking at, you can think of them as more as behaviors, how you interact with technology. So how you're using your computer at home and mobile phone and all of these things, how good you are at remembering the digits and all of that, or remembering how to use the device. So there's lots of work going on in instrumented homes and environments. There's some really interesting work going on in the US and in the UK that will... Eventually, people talk about digital phenotypes that will compress all of these different types of data to answer the questions around, you know, collectively a composite measure that allows you to start to think about healthy aging and unhealthy aging as well, of course. So it's never one single thing. We look at one single tiny slice of it, but there's lots and lots of other work. And Rachel's work will come into that as well, actually. We're interacting with, for one of our cohorts who have got chronic respiratory disease, we need to monitor pollution levels because they have an impact on mobility outcomes. So we have to control for it in the analysis. So all of these, ultimately, these devices, we need to pull the information and use it in the most appropriate way. Yeah, but we're learning. Good.
I was just going to say, my kids make judgments about me based on my inability to operate digital devices like the TV remote control, for example. Okay, so Rachel, there's an architect on the call who's asking about, says, thanks for the wonderful presentation, asking about how budget friendly and affordable a smart city can be and what are the major components of a smart city. That's a big question. And I noticed Lucy's just put her video on, so I suspect that means we're running out of time. Am I right, Lucy?
We've got a few minutes to carry on.
Okay, so sorry, it'll have to be that's a big question, of course, Rachel, but a short answer, I guess.
Yeah. Well, it's a really big question. I probably won't get to the heart of what you're hoping for, but I would actually say move upstream and look at like city budgets as a pie and choosing how the pie is going to be sliced, because you've got education, you've got infrastructure, you have all the other calls on your budget, health, for example. And so I would be hesitant to say that smart city sensors, you know, that should occupy a big chunk of that pie if it means that there's going to be less for these other components that are really important, like health and education for well-being, right? And so I think it's not just about the smart city piece and the budgets, it's actually one step up in the budgeting and thinking about all those moving parts. That's where the important decisions get made.
Yeah, so it's based on problem solving rather than build. As a technologist, our temptation is to build it and they will come, right? But it's about problems.
And I think cities face a lot of pressure to spend money on these, or to at least have sensors, partly as a branding and a marketing device, right? What kind of city are you if you aren't embracing the latest and the newest technologies, right? So it is a challenge.
Okay. Okay, just perhaps one more, just for Lynn. This is from Liz. Does the gait analysis take account of poor conditions for pedestrians, particularly people who are visually impaired?
Again, that's a really good question. That's a very precise set of circumstances. We are accounting for, we're looking at the outdoor environment when we're developing our algorithms, and we do this by tracking people's localization using GPS, so that we can accommodate changes in the environment, slopes, and all sorts of other things. And we look at weather. So that helps us to know that what we're measuring, we can measure accurately. And that's a fundamental feature of what we're trying to demonstrate. How that actually interacts with your behavior is an entirely different question, which is also important. and it links back to smart cities and livable environments and all the rest of it. So it is a slightly different question, and maybe what we are able to measure, we can then take that and look at that particular feature as well. And I would say that also applies to then understanding, if we can measure these things well, then understanding how we can work with different populations, such as visual impaired populations, to see the impacts of environment and to see if environmental adjustments could be helpful. I don't know whether that specifically answers your question, but I'm trying to look at future use of what we're doing.
Great, thank you very much, then. So I notice we're almost exactly on time for the end of the presentations. So thank you very much, both Rachel and Lynn, and thank you very much to the audience. I'll hand back to Lucy, who presumably will have a few closing words.
Thank you very much, Steve. And I would like to start by saying a huge thank you to Professors Steve, Rachel and Lynn for an absolutely fascinating presentations and discussion. It's been really thought-provoking, and I've got a lot personally myself to go away and think about, and I'm sure that's the same, and we can see that from the number of questions that have been asked. So thank you very much for joining us today and for asking those questions. It's really helped give a real interesting discussion. So thank you all very much for joining us as panel members and giving your presentations, and thank you to the audience for joining us. If you'd like to join us for the next Newcastle Discover event, we have two taking place in February. So we have one which is Pension Essentials, which will tell you everything you need to know about pensions, and one for those who are thinking about approaching retirement, everything you need to know about what you need to think about when you're approaching retirement. And they're delivered by Martin Allen from Scottish Widows. So do join us for that one. There's a QR code there, or you can find all the information for all of our events on our event website on the alumni site as part of the Newcastle University website. You have seen there's a feedback poll there to give us instant feedback. We will look at it. It's all anonymous, so we do not collect that specific data from you. So we will not be able to hold you accountable for what you answer. So thank you very much for filling that in. And also, as I mentioned earlier, we will be doing a prize draw after the event, and we'll be in touch with the winner for a Costa voucher to say thank you for joining us today. Thank you all again for joining us, and I do hope you've enjoyed it and found a lot of useful and helpful information, certainly thought-provoking, and we hope you will join us next time.